Hi everyone! In this presentation, I will give an overview on in vitro fertilization. In Queen Mary Hospital and in Guanghua Hospital, we work as a team. Ultrasound examination, egg collection, and embryo transfer are supervised or performed by subspecialists in reproductive medicine on duty roster. This is the overview of the presentation. Firstly, I'll talk about the hospital authority criteria and the age limit of private patients. There are certain recruitment guidelines in the hospital authority for IVF to be offered. Women must be aged less than 40 years old at the time when IVF is initiated. They must be legally married with no living child for the current marriage, do not have contraindications for pregnancy, and are adequately investigated. Clients with decreased ovarian reserve as indicated by screening tests will be excluded. Each eligible couple will be entitled to at most 3 IVF treatment cycles within the hospital authority. For private patients, we also have an age limit of less than 45 years old at the time when IVF is initiated. The next section is on screening tests. The screening tests before IVF for the wife would include a cervical smear and a swab taken from the neck of the womb, some blood tests, and an ultrasound pelvis. For the husband, he would have a semen analysis and some blood tests. IVF refers to the medical procedure where the egg is fertilized by sperm outside the body, forming embryos, followed by transfer of the embryo back into the womb. In the next part, I will go through the procedures involved in IVF. The procedures in IVF include several steps: stimulation of ovaries, egg collection, sperm washing and fertilization of eggs, and embryo transfer. During the stimulation of ovaries, gonadotropin jabs are given on a daily basis to stimulate the growth of follicles, as shown in this photo. Antagonist is added subsequently to prevent ovulation before the planned egg collection. And there will be monitoring by ultrasound to measure the size of the follicles. The stimulation takes on average about 10 to 12 days, but it's slightly different for different women. When the follicles are large enough on ultrasound scan, egg collection is arranged 36 hours after the HCG or agonist injection. We give antibiotics before the procedure to prevent pelvic infection, and the procedure is performed under conscious sedation for pain relief, during which intravenous injection of painkiller and sedative are given, and we would also give a local painkiller next to the neck of the womb. We do not have general anesthesia for egg collection in our center. The process of egg collection lasts about 10 to 15 minutes in most cases, and most women find it acceptable. Do let us know if you have any concerns, and we can further discuss on this issue. The procedure of egg collection is shown here. It is performed transvaginally under ultrasound guidance. We cannot see the eggs with our eyes directly, but the needle here aspirates the follicular fluid, and the embryologist will then look for the eggs under the microscope. And here we can see the sperms before and after sperm washing. There are two insemination methods. The first method, the conventional method, is where the egg and the sperm are placed together in the culture medium, and the strongest sperm will then fertilize the egg. In intracytoplasmic sperm injection, or we call it ICSI, a single sperm is injected into an egg. It is important to note that not all the eggs collected will be fertilized. ICSI is only performed in case of severe male infertility. For other indications, it may actually lower the implantation rate. In a small proportion of cases, there may be no fertilization, and in these cases, our team will review the management. The embryo formed is then transferred back into the womb using a catheter under transabdominal ultrasound guidance. Generally, we advise transferring only one embryo to reduce the risk of multiple pregnancies. There are some situations where embryo transfer in the fresh cycle is not advised. There is no difference in success rates between fresh and frozen embryo transfer in women with normal response. If you get pregnant after embryo transfer, we will arrange a pelvic ultrasound when you're 6 and 8 weeks pregnant to confirm that the pregnancy is ongoing. If everything goes well, we will refer you for antenatal care. In the following few slides, I'll go through the success rates of IVF treatment in our center. These graphs shows our recent data on the ongoing pregnancy rate and live birth rates following fresh embryo transfer divided by women's age. As the woman's age increase, the ongoing pregnancy rate and live birth rate reduces. The results are quite similar following frozen embryo transfer. Again, you see a reducing ongoing pregnancy rate and live birth rate as the woman's age increase. This graph shows the cumulative live birth rate following the entire IVF cycle. I will then go through the timeline of IVF. This diagram illustrates nicely the timeline of IVF. In the ovarian stimulation phase, which takes an average of 10 to 12 days, daily FSH will be given to stimulate the ovaries. Antagonist will be added to prevent premature ovulation, and ultrasound monitoring of the follicles will be performed. When the follicles are large enough on ultrasound, HCG or agonist trigger will be administered, and egg collection will be arranged 36 hours later. After the eggs are being collected, they will be fertilized with the sperm to form embryos. 2 to 5 days later, the embryo is transferred back into the womb. Generally, we advise transferring one embryo each time. Pregnancy test is performed 14 days after embryo transfer. IVF is generally safe, but there are possible complications of the treatment. These include multiple pregnancies, especially when more than 2 embryos are transferred, ovarian hyperstimulation syndrome, the symptoms of which include abdominal distension, vomiting, ovarian cysts, and there may be fluid in the abdomen and the lungs. The reason why we want to avoid multiple pregnancies is because it is associated with many obstetric risks, especially an increase in preterm delivery, which is harmful to you and the babies. The ovaries are much enlarged in ovarian hyperstimulation syndrome. The symptoms and signs to look out for include nausea, shortness of breath, sometimes because of fluid in the lungs, fluid in the abdomen, as well as a reduced urine output. If these situations are encountered, you must seek medical attention immediately. Some other possible complications of IVF include ectopic pregnancy, meaning that the pregnancy is located outside the womb, which is abnormal and can cause life-threatening complications. There can also be complications arising from egg collection, including bleeding from the ovaries or pelvic infection. There is also a slight increase in the percentage of birth defects in pregnancies after IVF compared to natural conceptions, as well as an increase in preterm labor and small for gestational age babies. The next section is on charges in IVF, which is shown more in the next slide. I will then go through some details regarding the consent in IVF. You'll be required to sign some consent forms before the IVF procedure. Regarding the storage of frozen embryos, the frozen embryos can be stored for up to 10 years from the date of freezing. It should be renewed every 2 years, and the notice of renewal must be signed by both the wife and husband and reach the center well before the date of renewal. This is extremely important because in the absence of written notice of renewal, the stored embryos will be discarded. The stored embryos can only be used when you are the parties to a marriage. Upon death of either partner, the stored embryos cannot be used by the surviving spouse to bring about a posthumous child or children. In the consent form, you are required to choose that upon death of either of you, or in the event of divorce or separation, what you want to do with the stored embryos. You can either choose to dispose them, donate them for the treatment of other infertile couples, or donate them for research, quality control, or training. I'll also talk a little bit on research. As our center is a university-affiliated center, there are many clinical and laboratory studies being carried out. You are invited to join, and you can learn more about them through our research team. But feel free to decline if you do not wish to join. You do not need to provide any reason for not joining our studies, and it will not affect your medical treatment. This diagram illustrates nicely the timeline of IVF. In the ovarian stimulation phase, which takes an average of 10 to 12 days, daily FSH will be given to stimulate the ovaries. Antagonist will be added to prevent premature ovulation, and ultrasound monitoring of the follicles will be performed. When the follicles are large enough on ultrasound, HCG or agonist trigger will be administered, and egg collection will be arranged 36 hours later. After the eggs are being collected, they will be fertilized with the sperm to form embryos. 2 to 5 days later, the embryo is transferred back into the womb. Generally, we advise transferring 1 embryo each time. Pregnancy test is performed 14 days after embryo transfer. To summarize, around 70% of follicles that we see on ultrasound contain eggs, and around 8 to 10 eggs are aspirated in each IVF cycle. Of course, this is different for different women. In addition, not all the eggs will be fertilized. An average of 70% of eggs are fertilized, and not all of them would continue to develop as embryos. We advise replacing 1 embryo each time. The cumulative live birth rate after 1 IVF cycle is around 40 to 50%. IVF is also associated with possible complications, including multiple pregnancy, ovarian hyperstimulation syndrome, pelvic infection, bleeding, as well as increased congenital abnormalities of the fetus. I hope that from this presentation, you can have an overview of the IVF treatment that you are going to receive. If you have any questions, you can always ask our medical staff when you see us. You can also visit our website for more information. The link is shown in this slide. We also have Facebook and Instagram accounts, and you can visit our page for the latest information. Thank you for listening to this talk. If you have any questions, you can reach us as follows. The phone number is a voicemail most of the time. You can leave a message with your name, Hong Kong ID card, as well as contact number, and our nurse will get back to you.